Have you ever heard of Ozempic, Wegovy, or Mounjaro? These names are everywhere, in conversations, on social media, on TV shows, and even among friends. It seems like everyone knows someone who's using them. The promise is tempting: lose weight quickly, control your hunger, and even improve your heart health. But are these medications really a miracle of medicine? Or are we looking at an expensive shortcut, full of risks and side effects that few people know about? This is a question that divides doctors, patients, and even celebrities. And today I want to talk to you about this in a clear, honest, and scientific way. For those who don't know me yet, I'm Dr. Joel Migalski. I'm a doctor, and here on the channel, I explain health in a simple, straightforward, and evidence-based way, always trying to translate science into real life. Today's topic is one of the most controversial at the moment, and if you stick with me until the end, you'll come away with a much more complete understanding of these medications. We're going to talk about how they work, what results they can really deliver, what risks are often hidden, and what the future holds for this market that already moves billions of dollars. But let's start at the beginning. What are these famous medications? Our body is an incredible machine, and every time we eat, the intestine releases chemical signals that inform the brain and the pancreas about what's happening. One of these signals is GLP-1, a hormone that does two essential things. It helps the pancreas release insulin, controlling blood sugar, and it tells the brain that we're already full, reducing hunger. It's like a bell that rings to say, "That's enough, you can stop eating now." The problem is that for many people, especially those with obesity and type 2 diabetes, this bell doesn't work properly. The brain doesn't get the message, the person keeps feeling hungry, and blood sugar remains high. And this is where medications like Ozempic, Wegovy, and Mounjaro come in. They are synthetic versions of this hormone, only much more potent. It's as if the bell that used to ring softly now starts ringing through a megaphone. The effect is immediate. The patient feels less hungry, gets full more quickly, stomach emptying is slower, and blood sugar is better controlled. This combination leads to significant weight loss and a major improvement in diabetes control. And the results are truly impressive. In clinical studies, people who used semaglutide, the active ingredient in Ozempic and Wegovy, lost on average 15 to 20% of their body weight in just over a year. Tirzepatide, found in Mounjaro, showed even greater reductions, reaching up to 22% in some groups. To put it into perspective, a person who weighs 100 kilos can lose between 15 and 22 kilos. This completely transforms one's health. We're talking about weight loss that, until now, was only possible with bariatric surgery. And the benefits don't stop at weight loss. In patients with type 2 diabetes, these medications help reduce glycated hemoglobin, decrease insulin resistance, and even allow for reducing or discontinuing insulin use in many cases. In addition, studies have shown that they reduce the risk of serious cardiovascular events, such as heart attack and stroke. In other words, it's not just about aesthetics, it's about saving lives. There is also evidence of improvement in liver fat, known as hepatic steatosis, which can progress to cirrhosis. Initial research suggests neuroprotective effects, reducing the risk of Alzheimer's and Parkinson's, and even benefits for compulsive disorders, helping people control alcoholism and smoking. I myself have followed patients who experienced remarkable transformations. People who used to feel tired, unmotivated, and had uncontrolled test results, and who, after starting treatment, managed to lose weight, improve their lab results, and return to an active life. For many, it's as if it was the first time they truly felt their body respond. This shows the transformative potential of these medications. But it's not all sunshine and roses. The other side of the story needs to be told. These medications also have important side effects and risks. The most common symptoms are nausea, vomiting, diarrhea, and constipation. For many people, these discomforts appear in the first few weeks and then improve. But for others, they can persist to the point of interfering with daily life. There are also more serious complications. There have been reports of pancreatitis, which is a serious inflammation of the pancreas. In some cases, patients developed gastroparesis, which is when the stomach practically stops functioning, causing pain, bloating, and reflux. People with pre-existing kidney problems may experience worsening kidney function. And some studies suggest an increased risk of eye diseases, such as macular degeneration. Another point that draws attention is the so-called Ozempic face. With rapid fat loss, especially in the face, the skin can become saggy and give a more aged appearance. It's not a health problem, but it affects the self-esteem of many people. In addition, concerns have arisen about psychiatric impacts, since some reports have linked the use of these medications to depressive thoughts and even suicide risk in predisposed individuals. This is an area where we need more studies. And there is also the risk of misuse. With the surge in demand, compounded formulas have appeared in pharmacies without proper quality control, and even counterfeit versions are being sold online. The FDA, the United States Regulatory Agency, has already issued warnings about cases of overdose and hospitalizations due to severe hypoglycemia in people who used fake products. This is extremely dangerous. We are talking about powerful medications that affect multiple systems in the body and cannot be treated as mere commodities. This phenomenon also raises social and ethical questions. The demand was so high that in many places, diabetic patients who truly depend on Ozempic to control their glucose were left without access to the medication because it was being used for aesthetic purposes. This is a serious distortion. Another controversial debate is the use in adolescents and even children, which has already been approved in some countries. Is it really safe to expose young people to such a new medication without long-term studies? Aren't we outsourcing to an injection the responsibility to address problems that are also social, such as the overconsumption of ultra-processed foods and sedentary lifestyles? And we need to talk about the issue of aesthetic pressure. When celebrities show off quick results with these medications, it creates an unrealistic expectation. The implicit message is, if you're not thin, just take an injection. This reinforces toxic beauty standards and makes it seem like weight is just a matter of individual choice, when in reality, it's a multifactorial issue. The risk is creating a society dependent on medication without addressing the root of the problem. The future is already being shaped. The next step is the pill versions. Orforglipron, for example, showed an average weight loss of 10% in 72 weeks without the need for weekly injections. This could make adherence much easier, but it also increases the risk of trivialization. Major pharmaceutical companies like Eli Lilly and Novo Nordisk are investing billions to dominate this market. There is already talk of a new generation of oral medications, which could become as common as drugs for hypertension. But will healthcare systems be able to bear these costs? Won't we end up increasing inequality even further, with a thin elite thanks to expensive drugs and a majority without access to this resource? In light of all this, the conclusion is clear. GLP-1s are a revolution in medicine. They offer impressive results for those who suffer from obesity and diabetes. They improve metabolic health, reduce cardiovascular risks, and can even bring benefits in unexpected areas, such as the liver and brain. But they are not magic, they do not replace healthy habits, should not be used without medical guidance, and are not free from risks. They are powerful tools that need to be handled responsibly. My message to you is simple. If you're thinking about using these medications, seek out a trusted doctor, weigh the risks and benefits, see if they are truly indicated for your case, and never use them without medical supervision. Medicine is not a trend, it's about care. And now I want to know your opinion. Do you think these medications should be reserved only for people with obesity and diabetes, or should anyone who wants to lose weight have access to them? Leave your comment, share this video with anyone who needs to better understand this topic, and don't forget to subscribe to the channel for more health and wellness content.